While making a video for Mental Health Awareness Month, a lot of people we spoke to mentioned a topic that we weren't expecting: spirituality.
More than 90% of American adults are using religion and spirituality to cope in some way.
But apparently in a clinical context, spirituality is underutilized.
Spirituality is not often used alongside other mental health tools by professionals. Professionals tend to shy away from spirituality.
We have this evidence to show that it's helpful, but we can also see that it's not being used to the extent that it could be used. So what is the barrier? What is getting in the way?
So how is it that spirituality plays a role in psychology? What are some of the benefits scientists are seeing? And what do we even mean when we're talking about spirituality? There's a growing body of research into the connection between psychology and spirituality, including work by this guy, Dr. David Rosmarin, a professor at Harvard University. In the Handbook of Spirituality, Religion, and Mental Health by Dr. Rosmarin and Dr. Harold Koenig, they found that hundreds of studies from around the globe tie various aspects of spirituality to fewer symptoms of depression, a lower incidence of suicide, and lower severity of alcohol or substance use. But why is that?
What drugs, alcohol, and suicide-related deaths have in common, in addition to despair, what the three have in common is impulsivity.
According to the APA Dictionary of Psychology, impulsivity is a tendency to act on a whim, displaying behavior characterized by little or no forethought, reflection, or consideration of the consequences. Research has linked impulsivity to negative mental health outcomes.
Religion and spirituality, I think, can buffer against impulsivity for a couple of reasons. When a person has a spiritual frame in their life, it's almost like there's another filter or another layer of control over their behavior. And it seems to be, in general, that people who are involved in spirituality and religion tend to be less impulsive and have more self-control.
Columbia University professor Lisa Miller published a study in 2013 that looked into how spirituality can actually change your brain and lead to positive mental health outcomes.
We found that those for whom a sustained personal spirituality was their lead foot, over time developed a thicker cortex.
When people find religion to be important in their life, there's actually greater cortical thickness, and that is a specific mechanism for protecting against the onset and the exacerbation of depressive symptoms over time, especially among people of high risk for depression.
According to Dr. Rosmarin and Dr. Koenig, spirituality can also promote emotional wellness, as evidenced by associations with greater life satisfaction, self-esteem, higher levels of marital and family functioning, and better adjustment to clinical concerns. So with spirituality having all of these mental health benefits, I had to ask the question, what is spirituality?
The way we define it in clinical science is any way at all that a human being defines and relates to something that they see is sacred, something that's greater than this material world.
Spirituality is a sense of connection with something greater than ourselves.
So I would say spirituality, that's what transcendence is related to that. I transcend myself, which then enables me to connect with that which is outside of myself.
Transcendence is ultimately about this idea that it's more than just you, that you connect to something beyond the individual. And I would argue that that too is fundamental to good mental health.
I think the world can be a lonely place, but if you can access that spiritual connection, then you kind of go, I can be okay because I'm not alone.
And while spirituality leads to this feeling of connection, apparently it goes even further.
It's not only to feel connected, but it's also to have a sense of purpose and meaning in life. As we know in the field of psychology, having a sense of meaning and purpose is a key element.
So Viktor Frankl has this whole logotherapy approach where he essentially says that much of mental illness is rooted in a lack of a sense of meaning in life. And when he describes what meaning is, it's essentially the confidence and belief that there's something larger than myself.
I think ultimately good mental health requires that we find meaning in our world.
There's a purpose to my life. I have something to contribute in this world. I'm on a unique journey. Spirituality is all about the journey. The journey never ends. And when a person feels that he or she is on a journey, They feel meaning in life. So all of these things are connected. Mental life, meaningfulness, spirituality, journey.
According to a study published in the Journal of Consulting and Clinical Psychology, in the USA, more than 80% of individuals with mental disorders turn to spirituality to cope, and more than half wish to discuss spiritual matters in psychotherapy.
We have some empirical data on this actually from McLean. What we found in our fairly secular enclave that nearly 60% of our patients had fairly or very much interest in discussing spirituality with their clinicians. And furthermore, a third of those people had no religious background whatsoever.
So there's interest in this type of treatment. There's research showing that it can be helpful. But apparently in a clinical context, some people feel that it's underutilized.
There are a lot of topics that are kind of like taboo. According to recent data, 10% of American psychiatrists will actively change the subject when a patient brings up spiritual or religious topics.
Often there's not this separation between our religious and spiritual lives and our mental health and the other issues that we're talking about in therapy. It's so intertwined, and I think that's the complexity in it, is that you can't necessarily parse it out.
So I think that we have to ask about these issues as a matter of course, have open, frank, supportive, sensitive conversations with our patients about it, and be open to the possibility that maybe this is a central aspect of their life, and maybe it's something that could really help them moving forward.
While spirituality might not be a helpful tool for everyone, it clearly works for some people, giving a sense of connection, transcendence, and meaning that have a host of psychological benefits. And while it might not be mainstream, we're seeing a growing body of research that can help clinicians increasingly use this tool alongside other methods of treatment. Thanks for watching. If you like what we're doing here, please subscribe. And if you have any thoughts on the intersection between psychology and spirituality, drop your comments below.